You are listening to Catholic Lunch Break here on AM 1430. This is the weekly program where we catch up with all things Catholic in the greater Houston area. This is Wyatt Goolsby with you. And we are blessed here in the greater Houston area to have some of the top medical professionals in the world. One blessing that comes with that is an organization that supports Catholic medical professionals get the resources they need to stay true to their Catholic values. Join us here on the program is Dr. Carla Falco. She's a medical doctor and the president of Catholic Healthcare Professionals of Houston. Carla, thanks so much for visiting us here in the studio. We appreciate it.
Thank you for having me.
For people who are unfamiliar, tell me about Catholic Healthcare Professionals of Houston.
Sure. Thank you for asking. We are a chartered guild or a local chapter of the Catholic Medical Association. That's a national organization. So our local chapter has the mission of providing teachings and fostering Christian friendship, providing faithful formation in the principles and teachings of the Catholic Church, and also building a culture of life, in our work and in our communities. So we have been going strong for about, it'll be 11 years now. Mm-hmm. So it's been a great organization. A lot of the core people who were part of starting up the group are still participating. And over the years, we've just kind of developed a pretty robust schedule for the year to kind of reach, healthcare professionals as a ministry, really. We're a ministry to healthcare professionals because there's so much going on in that field, not just contrary to Catholic beliefs, but also just how do we, maintain our faith in our day-to-day work as all people, struggle to do that. And so as this ministry, we meet monthly. And so if there's any Catholic healthcare professionals out there who would be interested, our website is www.catholichealthhouston.com. Mm-hmm. And please come to one of our monthly meetings.
Where do you draw a lot of your members from? And I say it because here in Houston, we've got the medical center.
Sure.
And I know a lot of medical professionals live in or around that area, parts of downtown Houston. Does it draw a lot from there, or is it pretty much all over the greater Houston area that we're talking about?
Houston does have that challenge of just the geography of it. And so our meetings are close to the medical center, so we do draw a lot of people from the medical center. Mm-hmm. We also feel like it's important to be there for medical students and residents. Okay. So we have a good group of students and residents, and their focus is in the medical center because the medical schools are there. And so wanting to meet close to the medical center in that sense. There is always interest in, because Houston is so spread out, of having, what about our colleagues in Katy, in the Katy area or in the Woodlands area? So trying to also reach out to them with, maybe not one of our weekday meetings, but also on the weekends when we have a weekend event.
That's a good point. There's lots of medical professionals all over. You mentioned the Woodlands. I know
Absolutely.
Sugarland has area, of course, which
Yes.
we'll talk about yours in a second.
Yes.
But you had mentioned the life issue, and I want Carla to unpack that a little bit. What
Sure.
kind of challenges are there for Catholics who practice medicine in kind of the secular world that we're in now?
Yeah, so the obvious issue is the life issue. So beginning life issues, end of life issues. And so depending on what specialty you're in, you may or may not encounter a lot of it. So for example, if you're an OB-GYN, you're going to encounter a lot, right?
Right.
But if or taking care of patients in, the ICU where they're dying, you're going to encounter a lot of end-of-life issues. Mm-hmm. There's also in pediatrics and in adult medicine, the challenges of transgender medicine. And then I would say just the overall, medicine is a subset of our secular culture, in the sense of there's a lot of distraction and pressure, I would say, for healthcare professionals in, seeing a lot of patients, trying to, get, it can be very insidious as far as that pressure goes, but drawing away from, what are we here for? So we're here for the patient. The patient is our focus. A lot of the other things that exist in the secular world can draw our focus away from that. And so, the purpose of medicine is the human person, is caring for the human person. And that relationship with the patient is really about accompaniment and then obviously offering your expertise. So you need to be a great expert at what you do. And then also be willing to accompany this person through their suffering, through their challenges with their health, to understand their health, and then also, how do they face that challenge with the help of your expertise, but also, the emotional, psychological, and, faith, challenges that people experience with that, which they may or may not be, involved with a faith or a religion. So I think just trying to refocus on the human person as the reason for medicine, I think is a huge challenge for people in medicine today. And I think it's critical for us as Catholics who are practicing medicine to remember that and to focus on that, to make sure that every day, we're entering into a whole new encounter with a new person that we see as our patient. And, and that person is the face of Christ for us in that moment. And so what does that mean? How do we interact with them? How do we offer our support? How do we make sure that we're understanding, the latest evidence that's going on related to whatever it is that they have? How do we do our best for that person and get away from, I need to see more people, there's certain pressures from this, hospital system, medical system for me to do X, Y, Z, on my schedule, and to not be so distracted by those things so that we can remember that we are seeing the face of Christ in our patients.
Of course, prayer is so important in all of this, Carla,
Absolutely.
both as individuals and then praying for others as well. We can, of course, ask the saints for their help as
Yes.
well. I want to mention the fact that you guys have a patroness for
Yes.
Catholic Healthcare Professionals of Houston, and that is Our Lady of Guadalupe.
Yes.
So I'd be remiss if we're on the Guadalupe Radio Network and I don't mention that. Why Our Lady?
Yes. So, when we were first starting out, we definitely wanted a patroness or patron. And we like to say that she chose us and that we didn't choose her. So she is also the patroness of life. So that's probably the main reason why. And we have a beautiful image that we bring to all of our main events of Our Lady of Guadalupe. And we have a wonderful tradition of having our speakers sign the back of it. She has obviously helped us in many ways, and her words to St. Juan Diego in a prayer is frequently a way that we end our meetings.
Very good. I'm quickly running out of time, but Carla, give me the website for Catholic Healthcare Professionals of Houston.
Yes. It's www.catholichealthhouston.com, and we do have an upcoming Catholic Medical Education Conference on April 12th, and that's www.convergingroads.com.
Excellent. We'll put together a PSA for that as well. Carla Falco, running out of time, but thank you so much for your time.
Thank
we appreciate
you.
your coming here and telling us all about it. We'll have to have you back, talk more about medicine and Catholic faith.
I would love that. Yeah.
Very good. And we thank you so much for watching and listening here on AM 1430. Until next time, stay Catholic, Houston.